Okay, so this activity you guys are going to be doing today is looking at different pulse points in your body. So think about when you go to the doctor and they want to find what your resting heart rate is. Where do they usually go? I mean, most of the time nurses will go right here and check that pulse point, but there's a lot of other pulse points in your body. So for this activity, you're going to have a table that you'll fill out, and you're going to kind of show me where the pulse point is in words, and then take a picture of yourself showing me that you're checking your pulse at that specific spot, and then kind of letting me know if you actually could feel the pulse or not. Some people have weaker pulses at some of the pulse points than others. Could be just because you have poor circulation. It also could be a lot of other factors if you're athletic versus not athletic, different kinds of things like that. So the first one that I'm going to show you is the carotid pulse. So that one's, most people kind of know where that one is. So if you follow your jawbone and go back into where it starts to bend, right behind that is where you'll feel that pulse point. Now, something also important to note during this is that don't ever use your thumb, because your thumb has its own pulse, and so you always want to use your first two fingers to feel your pulse. So feel that one there, and it should be pretty strong. Your carotid artery is pretty large. If that ever gets sliced, you'll bleed out in like 6 seconds. So obviously you don't want that to happen. Next one is temporal pulse. So obviously you all know that your temporal bone is here. That's the temporal portion of your brain. So if you put your two fingers here, that one's usually pretty strong as well. You can feel that one just because of that temporal artery that goes right across there. Then the one that most nurses find is the brachial pulse, which if you have your hand out like this, it's on the thumb side. That's where your radial artery is. That's the radius, the bone here. And that one, once again, they're pretty strong. That's why they're called pulse points. And then, I'm sorry, I told you the wrong word. That's not brachial. I'm sorry, it's late. That is that is radial, because that's your radius bone. Your brachial pulse is up here. And so that's the one that's like right in the antecubital region right here. This one might be the one that you might not feel super strong. It just kind of depends. A lot of you probably aren't old enough to donate blood yet, but when you donate blood, that's the artery they take blood from, the brachial artery here. I always struggle to donate blood because my arteries and veins are really small because I was premature. So that one might be one of the variable ones for you. So then brachial, radial, and then popliteal. So on the back of your knee, turn around and you feel like right here, kind of in that crevice, you'll feel a pulse. Once again, that one's kind of weak sometimes as you get closer to your extremities. That's the popliteal artery. And then we have the posterior tibial pulse. So obviously you have your tibia and fibula as the two bones in your calf. And so the posterior tibial pulse is the one that is like right here on your foot. And this is the one that you might not be able to feel super well if you have poor circulation. And then there's one more on your foot. So you're going to take your shoe off for this one. And it's the one that's on the top of your foot right here. And so kind of if you go straight back from your big toe, it's like right about here that you'll feel that pulse. People that smoke a lot within their lifetime, typically you can't feel either of those pulses because they could get a disorder called PAD, and it causes them to not have strong circulation and pumping the blood back towards their heart, and so they won't have barely any of a pulse. And obviously it's very dangerous because you need to have a pulse in your extremities because you need blood flow to all of those tissues in those areas. So you're going to find all of those pulse points, and then you're going to find your resting heart rate. So you need to be sitting down when you do this. It doesn't matter which place that you take the reading from, but most of the time they have you do your carotid or your radial pulse here. All you need obviously is your phone, and just set a timer for 30 seconds and count how many beats you have in 30 seconds, and then multiply that number by 2, because that's what you do. It's for 60 seconds. That's what your resting heart rate is. And typically a healthy average adult has a resting heart rate of 72 beats per minute. Now, obviously, this is not going to be something where if you get higher than that, I don't want you to start freaking out and thinking that there's something wrong with you, or if it's a lot lower than that. Typically, athletes are going to have lower heart rates. Even like professional level athletes, Olympians, things like that, they could have resting heart rates as low as 36, 35, 30 beats per minute. It's very slow because their heart is really strong. So just kind of figure out what your resting heart rate is, whatever it is. And a lot of time, if you've had caffeine or other things like that, it can be higher than normal just from external factors. So you'll put that on your student data sheet as well. And then the last part of this activity is just going to be kind of looking at how much blood your heart actually pumps out, and you're going to have to do a little bit of math. So that's it. Thanks for watching.